now I will like to call Manu, who has really different kind of thoughts and insights. And Manu, I'm also, looking at the different perspective that we discussed around saying that there will be more demand of healthcare, professionals than the supply, right? That's a different perspective that you had brought in. And I also realized that there are lots of questions around what will happen to the healthcare jobs. And so really looking forward to, your thoughts around the same. Over to you, Manu. Manu, you are on mute.
So, Papya, I would say the esteemed panel has in fact covered all the leadership skills which would be required in a crisis situation. A couple of them from experience and seeing on ground things I would like to add by just a few words is, one is the leadership always had humility. Now this humility factor has come into prominence. The leaders who have shown humility on the ground, on the shop floor, or I can say anywhere in a workplace environment, they have been able to motivate the teams. So humility has been one of the critical factors. Another factor is, in this COVID scenario, we have seen a flow of over information. We have seen information flowing from every single angle. We have not been able to sieve through and find which is true and which is a false one. So for a leader, it has become very important to help to screen this information and ensure reliable and transparent communication goes down to his team and they are able to act upon it. So what I would say is reliable and transparent communication is a key factor for the leadership today. So as we say, COVID has been a test for all the industries, everybody, human beings. The fact is, for the healthcare industry or the hospital industry, I would like to say, we started thinking about COVID much earlier than anybody else. We started preparing for it. But once it hit, we never knew that it is going to be that severe. So in this entire severity, I would say things that helped us, and you mentioned it in a very subtle manner, has been the telecom bandwidth availability in the country today. A lot of things that made the healthcare professionals able to deliver care has been riding on the telecom bandwidth. From the virtual consultations to the virtual, teams of doctors treating patients, from ICU care management, all this network has been built on the existing telecom facilities which were available. I would have shivers down my spine if I think if this thing would have happened 5 years back or 10 years back, what it would have meant to us, where doctors would not have been able to talk to each other, provide real-time data. Imagine if something would have, protocols would have changed in US, within next 24 hours, they would be implemented in other countries. So this has all been brought about with the speed of communication. So that has been one of the key things. Now, coming down to which you would say what healthcare is going to look like going forward. There is going to be a huge change in the consumption pattern of healthcare. So consumption pattern would be regarding how we end up using the healthcare facilities available to us. It was all of about touch thing. This has disappeared. This has disappeared. So this has disappeared from the perspective that virtual consultations are the new normal today, and they are going to stay. Telemedicine was there for a long time, but it never saw the importance. Within this 2-3 months, this has changed to an aspect that the growth in teleconsults has been in last 4 months in India only to the tune of 200%.